Hello and welcome to AT Talks, the assistive technology podcast. We will be your backseat driver, your road trip buddy and instant pocket mentor for the times you need a refresher. I'm Tammy.
And I'm Kate, and we're excited to welcome you into our digital space. We hope through this podcast you will learn more about specific assistive technology and its place in your allied health practice.
We hope you learn new things, solidify information you already know, and maintain a reciprocal partnership by asking questions through our DMs. The aim of episode 1, part 1, is to hear from our guest speaker who will provide education to you about the weekly topic. Stay tuned for part 2, where our guest speaker will answer your questions from today's discussion.
As it is our first podcast, we thought what better way to start off AT Talks than through looking at the basics of assistive technology. The aim for this episode is for you to understand a definition for assistive technology, the differences between complex AT and simple AT, and who can benefit from AT. We are excited to introduce our first podcast guest, Robyn Guthrie, to help us navigate assistive technology.
Robyn has been working as an occupational therapist for the past 27 years. She has worked across a wide number of areas within the health care and disability sectors, but predominantly in recent years within the area of adult acquired brain injury, spinal cord injury, stroke, chronic neurological conditions, multi-trauma and community rehabilitation. She has experience in all areas of occupational therapy practice, including individual assessment and intervention, the development of attendant care programs, the prescription and implementation of assistive technology, home modifications and supporting clients to transition to and from home into transitional and permanent supported accommodation. At the moment, Robyn is a consultant on the Transport Accident Commission clinical panel and a private practitioner in the community. She is also a director on the Australian Rehabilitation and Assistive Technology Association. She is also based in Metro Melbourne.
Thank you for joining us virtually today. How are things for you, Robyn?
Oh, thank you very much for having me, Kate and Tammy. It's very exciting to be given the opportunity to talk about all things assistive technology. At the moment, I'm in Melbourne and we're in lockdown and navigating our way through, different challenges than we're used to. So that's been an interesting part of practice. But thank you for asking me to be part of your podcast.
Of course, I can imagine there are some difficult times, and we're based in Queensland here, and it's quite nice with the limited restrictions we have. So we definitely feel for you, but thank you for taking the time to speak with us.
Absolute pleasure.
Yeah, so Tammy and I are fourth year students, and we're hoping that the listeners will be a range from new graduate to novice practitioners for assistive technology. We personally have only touched on the area of assistive technology at university thus far. So for those that are new to this field, it would be really great to have you share a quick refresher on what assistive technology is. And if you could give us your best pitch.
Yeah, so assistive technology is an umbrella term for assistive products and services. It's a field of AT which includes assistive products, sometimes known as aids, equipment, durables, medical equipment or appliances, and AT services, which refers to the human factors such as assessment, advice and evaluation, which help to match a person, their goals and their particular environments with specific products. So it, as I said before, it is a field, and it's important to remember that it is the assistive technologies or the products plus the services, supports, reviews, maintenance, etc., that are wrapped around that assistive technology for that person.
Yeah, so it's definitely not just the object that you've been given, it's everything that encapsulates that.
Yeah, that's
Absolutely.
Great. From our understanding and from an NDIS perspective, we understand that there are 4 levels of assistive technology prescription. Could you define these at all, so the levels of AT and the requirements that make up these levels?
Excellent. So the levels are really based around a few different factors. So they're the complexity of the equipment or the appliance, or product, the complexities of the person, the complexities of the environment, and the level of skill of the person who's going to be supporting or recommending the products that are anticipated to support that person to participate more in their daily activities. So level 1 is considered to be basic assistive technology. So it's pretty safe to operate, and you don't really need specialized assistance to set it up. Obviously, there are different situations where something that looks basic can have some complexity around that. But you can buy it online, or you can buy it in a local shop, and it includes appliances or products such as non-slip mats or equipment to assist with with feeding yourself. And people who are looking on the NDIS to obtain this kind of equipment can ask their peers, they can ask the supplier, the AT supplier, and they don't necessarily need that specialised skill. So level 2 is standard assistive technology. So again, you can generally buy this from your standard AT supplier. It's not customised, but you might need some help. The person might need some help to set it up. So to change the height of the product, to ensure that it's compatible with the environment in which the person is going to be using that product. And examples of this include like transfer benches or shower chairs, sort of some very simple basic handrails. And it also depends, again, as I've said before, on the person's capacity. So have they used that type of device before, and what is their level of complexity and need? So that's level 2, that's standardized, a standard assistive technology. So as you can see, it's going from level 1 is the basic through to the more complex. So level 3 is specialized assistive technology. So again, this can be purchased kind of off the shelf, that requires some adjustments or modifications. So it does need a specialist practitioner to review and assess and provide recommendations around the use and the appropriateness of that product for that person. And level 4 is the complex, so AT. So this is the complex products that are custom made, and some of the components can be off the shelf, but the way that excuse me, the way that they're put together is more complex and has to address the specific needs of that person, and that includes power wheelchairs, complex bed systems, communication devices, environmental control units, and home modifications.
Yeah, thank you. Wow. So there's 4 levels, 1, 2, 3, 4, and there's definitely a broad range of complexities among that. Going off that, who can recommend these levels of assistive technology? I'm jumping questions. It seemed a bit more relevant.
No, that's fine. So an AT assessor is someone who is able and in some instances trained to be able to consider a person's needs and situation and to identify the most appropriate AT to their needs. So in Australia, this can be anyone from an allied health practitioner, so an OT, a physio, a speech pathologist, a continence nurse, because obviously there are specific requirements there, a dietitian, psychologist, a rehab engineer will be looking at very complex equipment and working as part of a team. I think that's a really important part to consider with AT recommendations, is ensuring that there's a very clear collaborative approach between the different practitioners involved in supporting somebody in the community. And at the moment with contemporary disability practice, we're trying to move away from that whole thought of it being a prescription to being advice or a recommendation or a journey towards goal achievement, and doesn't necessarily with level 1 and 2, or particularly level 1 AT. Within the NDIS space, there's a lot more focus on potentially having mentors who do have some certification in AT, but they can be users of that particular technology as well, to give advice and support around that to people looking for this kind of assistive technology. So that's a pretty long-winded answer to the question, but I think again it is very team focused, and I think when you're looking at complexities especially, you do need to make sure that the appropriate people are in the room looking at what is appropriate for the person. So the physio, the assistive technology supplier, the OT who's looking particularly at environment and function, and all putting your heads together and coming up with the most appropriate recommendation for that person.
Yeah, and ensuring our scope as well, you mentioned that. So I think it's important that the person recommending does know their scope as well.
Yeah, it seems
absolutely.
Like looking at those levels, it's going to, reach a range of audiences as well. And I guess my next question is, who can actually benefit from assistive technology? Looking at, we have 4 levels of it, and it's simple to complex. It sounds like everyone, but what would you say to that?
Well, that's absolutely right. I think it is everybody. It's everyone from children through to the elderly, and looking at technology from a mainstream versus, a specially engineered perspective. There's the whole spectrum of technology that supports people to achieve their goals, whether they have a disability or they don't have a disability, but they have milestones such as age-related impairments that they need to try and overcome. So it's about trying to look at what is the product or what is the support that's going to assist that person to achieve their functional goals. So everyone really, we're all using some kind of assistive technology or technology to be able to achieve our goals.
Wonderful. That's a great answer. Thank you so much, Robyn.
And I think also it's helped us understand, just a basic level of who can recommend and where to go with that.
Yeah, that's it. I guess that's all the questions that we have today, because we're trying to keep it short. But I just wanted to thank you, Robyn, for coming on and sharing your knowledge and educating us a little bit. And just for the listeners, thank you for listening today. However you're listening to this podcast, whatever time of day it is, we hope it sparked some interest for you and helped you understand what AT is, the difference between the levels of AT, and helped you understand who can benefit from this.
If there are any questions that have risen from this conversation with Robyn and you wish for her to answer them, please contact us through the details in the poddy description. Furthermore, if there are other topics you wish for us to discuss, or you want to get involved and be a guest as one of our podcasts, please contact us.
We look forward to hearing from Robyn in our next episode, What Even is AT Part 2, as we invite her back to answer some of your questions from today's discussion. Bye for now.